Hi guys, a short video for you for a life-threatening emergency called acute epiglottitis. This is one of the life-threatening differentials of an acute wheeze when you see a patient who presents with this. So important things to bear in mind. What causes it? Haemophilus influenza B is the commonest cause, and thankfully this condition is now becoming very, very rare because we've got the Haemophilus influenza B vaccination program, but nevertheless you should still be mindful of this diagnosis. In terms of how does it present, normally you will see a child who cannot swallow and cannot talk, and the classic feature is that they're normally drooling saliva and they may be sat forward, so they're kind of sat at the edge of the chair. Parents are quite worried about them as well. The most important thing, and this is the crucial thing that you have to be mindful of, you must not examine the throat, you must not examine the airway, because that can lead to a full-on obstruction and closure of the airway. So that's a complete contraindication. So do not examine the airway. It's an urgent case, so it should be managed urgently in theatre by the on-call anaesthetist, by the on-call ENT doctors, and they will intubate the airway. And the classic feature on laryngoscopy is a cherry red spot that appears at the back, and that's characteristic of epiglottitis. Once the airway is secure, then blood cultures are taken and IV antibiotics are given. The antibiotic of choice will vary across the country based on local hospital guidelines. They often tend to give IV cefotaxime. Hope you found that useful, guys. Quick overview of epiglottitis. Important things that you should be aware of for your exams, for your written exams, clinical exams, and most importantly, when you're practicing as doctors on the wards and in your GP surgeries. Make sure you do subscribe to our YouTube channel, Inspire Medics, our Instagram page, Inspire_Medics, our Facebook revision pages for PLAB 1, PLAB 2, and the combined AKT and CSA Facebook revision group, and our Twitter page, where you can follow us on Inspire_Medics for alternative medical content.